Alors, bonjour, bienvenue pour le Topik Konversasyon. Et aujourd'hui, par Martin promet tout, il y a une conversation, moi, qui est idéale et important pour un couple qui a une situation que vous avez envie. Comment cette famille, mais par contre, certaines fois, il y en a, pour une raison médicale, il y en a une difficulté qu'ils ont rencontrées pour les autres pour conception arrivée. Alors, aujourd'hui, bon matin, Dr. Suganya, pareil l'habitude, il est là, dans le studio avec nous, et nous pouvons faire une conversation. Le traitement qui est IN, qui est capable d'assister, faire une conversation. Aujourd'hui, nous pouvons nous autres maximum d'informations que nous sommes capables pour ou guetter, est-ce qu'il s'en ça traitement IVF, IN qui ou, comme un couple, vous avez envie de considérer, et qui bonne difficulté, qui bonne challenges, mais aussi qui bonne résultat positif, ça traitement est capable de mener pour ou dans la vie. Alors, aujourd'hui, bon matin, mesdames et messieurs, bon grand plaisir. Comme d'habitude, nos conversations pour en anglais, mais mon introduction avec mon invité, Dr. Suganya. Good morning. How are you this morning, doctor?
Bonjour.
Ou bien?
Moi bien, merci.
Ah,
I'm
tout bien
fine.
aujourd'hui.
Thank you.
So, how have you been?
Very good.
Yes.
Very happy. Full of adrenaline after watching out for the FIFA
Yes.
World Cup beach soccer here happening, and I can feel the vibe still.
It's still around, isn't it?
Yeah, it's still high, and I
Yeah.
can still feel the energy of positivity.
All right, doctor. So, as usual, you know the drill. We're a bit nosy. So, how has things been for you
Yeah, very good.
since the last time we met?
Yes, very good. In
Very
fact,
good.
Very good. And
yeah.
a lot of awareness. I really want to thank the Bonzo Cecil team because we are stepping into the zone where we are creating awareness and we have hit the right spot. Now, people often reach out for even the smallest issue
Yeah.
at the earliest. So, it is always sooner the better when we
Yes.
are able to identify, recognize the problem, we
Yeah.
can always address it properly.
All right, and today's topic you've chosen is IVF. It was something we addressed last time when we were talking.
Yes.
It was part of the conversation.
Yes.
But today you want to amplify and add on to that and
Yes.
provide as much clarity and information as possible for our viewers this morning. Now, IVF, doctor,
Yes.
what is that? Let's give us a definition of that.
All right. IVF is in vitro fertilization, where we collect the sperm,
Okay.
we collect the egg, prepare the embryo outside the body. Means we have the culture media
Yeah.
similar to that of the mother's womb, and we prepare the embryo until the embryo divides, have got the good cell division. There are two ways now. We immediately transfer or we prepare the uterus and then put the embryo inside. So, freeze the embryo, take the embryo 3 months after that, then the results are very high. Fresh transfers usually are like very, very reserved for good womb with good receptivity.
Okay.
We don't want to, already the couples are excited, anxious to have baby.
Yeah.
All I ask my patients or the couples to be, the parents to be, is wait, be patient, because we should allow the cells to divide, the embryo to hatch,
Okay.
and then only we can place it inside. When you
Let-
rush,
in not so many words, let nature take its course. as we
yes,
say.
nature has to take its very own call. We know that once a cell starts dividing, it is frozen,
Yeah.
and then we put that inside after 3 months after preparing the mother's womb.
Okay. Now, of course, this is what we are talking about, IVF, this morning. Now, before we get into all of that, before we even start contemplating, what are some of the causes that we've spoken about them? Just to recap, what are some of the causes that can lead a couple to eventually want to explore the option of IVF?
All right, that's a very nice question. You see, the couples who are opting for IVF,
Yeah.
I can tell it has two divides.
Okay.
As the male partner, the female partner is also involved.
Okay.
So the male partner has to be evaluated first. What if there is a very low sperm count or with poor or dead sperms inside?
I like how you've changed, eh? It's not the ladies first now, eh? Not the ladies first, but the gents. Okay.
Yeah,
The boys will not be happy about that.
But what happens exactly is,
Yes.
because of the poor lifestyle or because of the age, there are plenty of factors. I'm
Okay.
just emphasizing on two major factors which I am encountering here in Seychelles. The elderly age group and poor lifestyle they live because of the poor eating habits and the alcohol consumption rates. So what happens exactly is the sperm loses its quality.
Okay.
So when the sperm loses its quality, the normal morphology totally collapses.
Okay.
So the head, the tail, the body doesn't form. So the sperm that needs to swim up to reach the right egg doesn't do so. So when the sperm count is considerably low, then the male partner can opt for IVF, because in IVF we collect the best, the good quality sperm with a good swim up and good morphology. And once we collect the sperm, then we make the egg to meet the sperm in the culture base and allow the division.
Less work for the boys.
Yes.
Okay. What is the... oh, sorry. Continue,
No
doctor.
problem.
What is the best... I see you emphasizing quality
Yes.
over quantity.
Yes.
What is the best quality sperm? What is the
Okay.
ideal sperm?
The
if we can
ideal-
say that way.
Yeah, I can, because quantity, usually men have greater than 20 million counts, all right? But the range will be from 20 to even 150 million.
Okay.
All right? We are not worried about the quantity. The quality here I focus upon is about the external, or when I look into the microscope, it should have the proper head.
Yeah.
It should have a cap, like the men wear the cap.
Yeah.
So it is called that cap called as the acrosome. I am speaking technical here.
Yes.
But people need to know what exactly the sperm has to have. The sperm has to have a head, the neck, the body, and the tail.
Okay.
Like that of the tadpole.
I was about to say that, yes. Okay.
So this is the best quality, and it should have a normal swim up. It should be able to swim in the culture media and at the faster rate. So this is the point we emphasize on the quality. Any sperm that is slowly moving, non-progressive, absent tail, no head, no cap, then dead ones, then that affects the quality.
Apart from, of course, our ways of living, our lifestyle, the eating, the drinking, smoking as well is part of an issue. Can somebody who's living the perfect lifestyle still have issues with their sperm?
Yes, that is surprisingly becoming more common now.
Oh, okay.
That is because since you emphasize the perfect lifestyle habits,
Yes.
even though they have this when they find it difficult to conceive.
Okay.
Naturally, in a period of 6 months of regular sexual activity with no protections used, when the couples are unable to achieve pregnancy, then the call has to be made, whether it is the male or the female. When we look, we are actually surprised to see a lot of dead spermatozoas. I will emphasize on that because of the internet and the social media and
Yes.
a lot of screen time spent by the male partner, the radiations, the stress levels that affect the quality.
Okay.
Now you got me.
Yes.
Because though they live the perfect habit, though they have the perfect lifestyle, though they are teetotaler, they have to have their stress level always under check. The stress, they need to meditate. Because now we are in the world where we are fast moving with a lot of inputs available and with a lot of work to do, and we are, like when we assess, even our own thoughts have got this very different idea of jumping because we are used to the screen swapping technique. Now our thoughts also has been tuned to jumping thoughts. So the level of hormone stress is increased and it damages the quality.
Doctor, I know we are exploring IVF as a treatment, but what if the boys want to try and do something to help themselves? What are some of the exercises that they can do? I know, without doubt, we have to bring in masturbation into this conversation. Does it help? Does it actually provide a better result when the time comes for the male partner to be able to
All right,
to do
I
the
can
test.
understand. You want the lifestyle modification or few tips for the male partner to improve the quality.
Yeah.
All right, I give you here. Wake up early, go to bed early, 10 p.m. after, no screen time.
Okay.
Monitor your screen time. The screen time on an average in a day can be between 1 hour to 2 hours
Okay.
with frequent intervals. If the person is doing his job on glued to his chair, then frequent getting up from the chair and walking, because blood circulation is needed.
Okay.
And don't wear tight underwears,
Oh.
because when you wear the tight underpants, the temperature is altered for the sperm. So not hot. That's why I don't encourage men to work with their laptops on their thighs, on their laps.
Okay.
Though it's called as laptop, it
Yes.
is supposed to be a desktop.
Yes.
All right. Because the amount of radiation it passes
Yeah.
and the heat it causes, the underwears, if they are wearing it tight, there is no ventilation.
Yeah.
The heat inside circulates, and you know the scrotum, the balls, which is actually a protective covering designed by nature and God to protect the sperm. When it is heated up, then the sperm totally dies inside there.
Okay.
So avoid wearing tight innerwears. Then regular fitness activity for 45 minutes a day, not asking for more, at least weekly thrice.
Okay.
And skip away from alcohol.
Yes.
Stay away, a strict no to smoking. I'll explain why.
Okay.
Because the nicotine in smoking damages the tubes where the sperms has to pass through.
Okay.
The sperm has to pass through the canal and come out.
Yeah.
It has to do the swimming. And what happens when this nicotine, the nicotine actually, we have the canal that pushes the sperm. Half of the work is done by the sperm by its swimming technique like this, and half work is done by the tubes, which has got the movement helping the sperm to push away.
Yeah.
The nicotine totally damages the tubal canal. And what happens? The sperm gets stuck. So, whenever the male partner wants to do a sperm analysis, please follow these rules. At least a month of no smoking, stress-free life, 2 days of sexual abstinence,
Okay.
and then go for the sperm analysis. Then that will give them the correct result. I want to do a sperm test. I'm good. No, that is not the way. Please prepare yourself and then go for the sperm analysis.
And the elephant in the room, the masturbation part, if we can
Yeah, the
address
masturbation-
that.
Yes, the masturbation part I can address.
How good or how unhealthy is it for somebody who's exploring the options of IVF? Because certain people might think that that would be a part and parcel of the process.
Yes, you see, collection of sperm in IVF is done only by masturbation.
Yeah.
All right? And what happens is we need the proper erection.
Yeah.
Only then the sperm can come out. If the person frequently masturbates, if that is a habit, then the nerve that is responsible for keeping the erection process loses its strength.
Okay.
So don't go for frequent masturbations,
Yeah.
and go for it, because that is one of the option of collecting the sperm.
Yeah.
There are plenty of options, but this is the easiest way, because otherwise then we need to put the needle directly into the scrotum, collect the sperm.
That's part of the process.
That is the next step where the male partner is not able to masturbate.
That's the worst case scenario.
Yeah. So let's not lose the nerve. Keep it always healthy, and no frequent masturbations, no unhealthy places where you masturbate and collect infection.
All right, so there you go. We put that out of the way. Let's continue with our conversation. IVF, aujourd'hui, bon matin, mesdames et messieurs, un procédé qui a exploré pour un couple qui a des difficultés pour conception, mais c'est par contre par Elodie, et tout est traitement médical, quand on a besoin, approche Dr. Suganya, voler apprêtement, faire consultation, est vraiment important pour faire sa conversation avec le docteur avant et après, explore toutes les options après qui nous faire conversation. Yes, doctor.
I would like to add, about the masturbation. When the sperm has to be analyzed by masturbation technique, I really want the person to be stress-free. Because the environment, the place where you collect the sperm, it has to be calm, quiet, because the gush of negative hormones will kill the sperms then and there like a battle. So, this is number one. Number two, collecting the semen at home and depositing in the lab for analysis is not a good idea. Reason, the travel time taken for the semen or the sperm to reach the lab should be within 10 minutes. And you understand the temperature we were talking about? It should be in a clean container. The container should be collected from the clinic, and then it should be taken at home, kept in a sterile way. So, always collect the sample in the hospital premises. I know it is little uneasy, but if you really want results, please go for the collection there, calm yourself, and then do the collection.
Can the ladies help?
Of course. I have seen my patients who want their female partner close by to
For moral support. Has to
anything for the baby.
Yeah, anything for the baby.
Anything.
After all, it might be a different way of getting the baby, but it's both participating.
Anything.
Now, let's walk through that conversation, all right? Sylvia walks in and she's exploring the options of IVF, and what are some of the normal questions or the conversation that you'll be having with your patient? Where do we start?
Step one,
yes,
I can put 5 questions. When the couple walk into my chamber, the first thing is they are anxious, they are hopeless, and they have already Googled a lot.
Yes.
They are flooded with info. All right. So now, counseling. Always we start with counseling. Begin with proper interrogation. Without properly addressing the issue, we cannot jump directly, okay, you have come for baby, plan for IVF. No, it doesn't happen that way. I need to properly address, like we have explored all the possible deformities or like available, like options available with the male partner. Equally, now the female come in a role. Now, how frequent is her period? Is she menstruating every month? Does she have cramps during her period? And most importantly, how frequent is their sexual activity?
How frequent should it be, doctor?
People actually go under the misnomer that everyday sexual activity is needed for consumption. It is not so. Because the woman, the lady ovulates only from day 9 to day 19. The range from the day of menstruation that is marked in the calendar as number 1. The 14th day will be the average ovulation day. But the eggs survive for 72 hours. So we don't want to miss if it is an early ovulation. So we go early at day 9. If it is a late ovulation, we jump even to the late date at day 19. So the range is between day 9 to day 19. You have regular sexual activity. And then it is countable for 6 months of trying, and nothing happens, no magic happens, then the evaluation comes. The lady is completely evaluated on a hormonal basis, done an ultrasound, check for the quality of the eggs. Now, this is very important. I really need to know how many eggs the lady has, because the PCOS is running very high here. The problem of polycystic ovaries, an irregular period.
And is that common in Seychelles, doctor?
Yes, endometriosis and polycystic ovaries are increasingly rocket high now.
Now, let's pause with that information. I know perhaps there's a lot of ladies in these situations where they're like, oh no, does that mean I can't have a baby?
No, they can. Of course, that is the key here. The thing is that we need to remove only the dead eggs from the ovary by laparoscopy. All right. The endometriotic tissue or the cyst that has to be knocked out, so the healthy eggs can allow enough space.
So we're cleaning house.
Exactly.
We're cleaning house.
The eggs can now have enough room to grow. The maturity of eggs can happen like the sperm and then hatch out. So this is step 1. So we do a complete hormonal analysis, an ultrasound, a laparoscopy, find out where is the problem, whether it is in the uterus, the tubes, or in the ovaries, and find out where the problem is, and then I address the proper solution. It is not direct decision of IVF. It is beginning with proper history taking. Like I need to know in and out of the couple's activities, their routines, their lifestyle. What is it really hampering or damaging the babies from forming?
Yeah. Is there any possibility that a couple could not be compatible?
Not to my knowledge.
Okay.
Because every baby is a miracle and every couples are compatible. The only problem where I address is cancer, because the cancer
Yes.
in condition, if the lady has got cancer cervix,
Yeah.
she needs to freeze her eggs and we need to find a surrogacy.
All right.
All
Let's
right.
stick to freeze our eggs right now before we move to anything else. This is an option. We have a lot of young people right now who find they are not ready to have a baby. How old would you recommend a lady to freeze her eggs if she's not yet ready for planning a family?
All right, I get you, because the ideal building of the egg quality will
Yeah.
begin only from 20 years plus.
Okay.
Not before that, because the eggs has to go for maturity. So when, like the girls are like they are focusing on their career, the education part, so the 20 to 30 years, if they really want to focus on their education and want to conceive after 30 or 35, then they are given the chance of freezing their eggs.
Okay.
And the last age limit to freeze the eggs, would you like to know that?
Yes, please. I think it's fundamental.
Is around 45. Not late.
45?
Yeah.
Okay.
Because after 45, you can still freeze, but the quality is going down with every year.
Okay.
We
All
lose
right.
the quality.
Yes, all right. So we're moving on to IVF this morning, and of course, nous pouvons faire une conversation. Et vous capable participer à une conversation de 88, 89, 89. So, aucune question au capable de demander nous aujourd'hui bon matin. Now we've had the consultation, we've spoken about IVF. What are some of the expectations?
The expectations from the couple.
Yeah, because a lot of people come and they assume right there and then
All right.
we're ready to go.
That's
We're going to have a baby.
Yeah. So the expectations from the couple, first they need to mentally prepare themselves, because it is not a one-stop procedure. You come, you give your sperm, I collect the egg, then you go back. No, it doesn't happen that
Yeah.
way. So the preparation has to be between the couples. They
Yeah.
speak to each other, come to terms.
Yes.
Okay, we have chosen this method for consumption. We give a try. And the second step will be taking care of the lady's menstrual calendar.
Okay.
We really need to have a regular menstrual calendar maintained.
Data collection is very important.
Data, yeah. Because the egg collection can start only from second day of period.
Okay.
So we give medications
Yeah.
and injections, not deep inside. It is like just given like the diabetes
I was
insulin.
about- yes.
Yeah, like the insulin, very small needle, very thin needle.
Okay.
All right?
How long a period, doctor, are we talking about?
It's only about 5 injections every day. All
5
right?
injections every day?
Yeah. See,
Okay. But
think.
it's not, it's skin deep.
Yeah.
Skin deep we're
Yeah,
talking about.
it is like a small prick like you do for the
mosquito bite?
tattooing, like nothing, it doesn't hurt.
Okay.
All right?
And
Be-
over how long a period of time?
No, only for 5 days, because
Oh, for 5
every
days.
day,
Yes.
every day after giving the injection, she will be monitored closely by me in ultrasound and her blood value.
Okay.
According to the ultrasound, egg growth and the blood value, now we realize what is the next level of dose she requires. Some might require higher dose,
Okay.
some might require minimum dose. So we adjust the dosage so we reach the good quality eggs.
Okay.
See, this is the key here. Patients who have lost I don't call them patients, they're mothers to be, who have lost their hope or who have tried IVF before
Yeah.
and now want to give a try. They need to take a break of 3 months and come back fresh, because we need the ovary to prepare itself with good blood supply. Blood supply is the key.
Yeah.
So once there is good enough blood supply,
Yeah.
5 days, alternate days or daily dosage,
Yeah.
and then she's going to sleep for 10 minutes. It's absolutely painless procedure, and I'm not going to
On a scale of 1 to 10?
Scale of 1 to 10 is 10 of 10. She's going to sleep for 10 minutes.
Yeah.
And I'm speaking about the success.
Yes.
And I'm not going to cut her abdomen and take the eggs out.
Yeah.
See, the collection of eggs is only by the ultrasound method we used to see through the vagina.
And we spoke about that last time, yes.
There is a very small needle,
Yeah.
and we suck all the eggs, healthy eggs out, and immediately after the eggs are collected,
Yes.
followed by the sperm. I believe you have a very bad flu. Please take care.
Yes.
All right. Then the sperm is collected and the embryos are formed. So here, transparency is the key, because we don't want to switch samples.
Okay.
I'm very particular, because once the egg is collected, then the male partner's sperm is collected.
Okay.
And then only the fusion happens in my lab. That's how we work.
That's how she creates the magic.
Yes.
And now, how long a wait? Because waiting is fundamental. Letting the magic take place. How long does it take for the magic to take place?
It's only 3 days. Once the sperm and eggs are out,
Yeah.
it starts to divide.
Okay.
By third day, I'm informed, or I can go to the lab and see for myself whether the cells have started dividing. 2 cell, 4 cells, 6, 8 cells and 16 cell.
Yeah.
So once it reaches the 16 cell stage, we freeze it. So from 3 to 5 days, if they can hold all the tensions low, keep them calm, I can
Yes.
give them all the positive answers. And you know what? I really want to highlight on this. It is not one embryo that is formed.
Okay.
Multiple embryos are formed.
Okay.
All right. See, we collect maximum eggs, and the maximum eggs with good maturity.
Yeah.
And suppose, for example, if I say I'm able to collect 6 to 8 eggs or 8 to 10 eggs, depending upon the ultrasound,
Yes.
I will be given a rough picture. I will be able to form around 8 embryos.
Okay.
Serious. 8 embryos will be formed, and we accumulate 3 embryos in a plate and freeze it.
Okay.
All right. And based on the quality, then the embryo transfer, the good ones are taken and put inside, and the rest of the embryos are frozen for a minimum period of 5 years, so they can come back and have the embryo transfer.
And don't have to repeat all of that process,
No.
the needling, etc.
No.
There's plan B, as we say.
Yes.
Now, plan A. How many are we choosing, you say, to put inside? We say 67, you said?
We are going to place only 2 inside.
Only 2 inside?
Yes, we begin with 2, so we are expecting multiple gestations on high rate.
Okay.
Right? So 2 embryos always are placed inside. So the uterine receptivity, according to the blood flow,
Yes.
can allow a single baby to grow or both babies to grow.
Ah.
See, miscarriages are very common if we put one embryo. See, again, the lady has to go through the hormonal shift every time she prepares herself. So once the hormonal shift and the womb is ready, then we place both.
Okay. Doctor, I have an interesting question from somebody here. Good morning. I have a question, please. I am 42 years old. I have 2 kids before, and I'm trying to conceive again now and having issues since 5 years ago. What does doctor think is the problem, please? Is it my age or any advice, please?
Is she a lady?
I'm assuming, yes, she is.
Say hi to her.
Hello.
And not to lose hope, 42 is not too old as long as she's menstruating. And there is a positive note here, she already had kids.
Yes.
All it needs a quality.
Yeah.
And now, as I said, I always start with the male partner.
Ah.
Check the male partner's sperm
Yes.
count and go for the equality assumption, like how good is the equality by doing an ultrasound, and then she always has the chance of conception naturally.
I have to bring this conversation because at the end of the day, we're focusing on the guys there. I know we're focusing on the ladies as well, but somehow, how easy or uneasy is it to convince the guys to come in and have a check and talk about their manhood? Because a lot of the guys are very macho when it comes to their sperm counts, who they are as a man. I am able to conceive, and to tell them that, hey, there might be a problem with something.
Yeah, I really appreciate this question because this is what I encounter in my OP.
I'm assuming this is like a head-on conversation all the time.
Yeah, the couples have to walk to me as couples.
With an open mind.
Yeah.
Okay.
It's not only the lady who's
Yeah.
coming to me for consultation and for baby.
Excuse, yes.
When the sperm is needed, the man has to walk in the chamber.
Yeah.
And I can perfectly understand, because the mindset of the male is like, I'm good, I'm able to produce
Nothing's
babies,
wrong with me.
nothing is wrong with me. It doesn't happen. We need to really create awareness. Though they are fit physically,
Yes.
though they are refraining from alcohol and smoking, they need to focus on the stress level.
Okay.
And above all, when it comes to baby, after all, it is their sperm.
Yeah.
So why not have a check?
Yeah.
Why not make a count? Why not go for the good quality ones? And educating them, creating the awareness. Most of my male patients, I won't call them patients, I don't know, they are able to understand, and it is only by creating awareness we can overcome this.
A space free of judgment, a space free of ego, a space
Yeah.
full of hope,
Yes.
and
An
good
ideal
thoughts,
couple will
positive
have
thoughts.
an ideal couple will have mutual understanding.
Yeah.
You don't even have to argue about ego there.
Okay.
The understanding is felt from here,
Yeah.
heart to heart understanding.
Yeah.
They want a baby. Ultimately, the net result, they are focusing only on the baby. It's
Yeah.
a give and take. So they opt for anything.
Doctor, number so that the person can contact you to have a conversation initially before setting up a consultation.
All right, please visit me at Dr. Murthy's. Please
Yes.
contact me on 2750
Yeah.
in WhatsApp or in direct call to me. Please fix an appointment, and maybe I will be I can guide.
Yeah.
See, I'm not going to push you into taking decisions, but the proper guidance is needed. Please reach out, the sooner the better, before the damage is completely taken.
Okay.
So, we have to attend the issues as early as possible. Please contact me on 2750
Last time we had a conversation about this, and I'm glad that it came back. Women that don't necessarily have a partner, but would like to view the options of having a baby.
Sorry, please come again.
Does not necessarily a female.
All right, I got you.
Yeah.
Who doesn't have a male partner?
Yes.
Still wants to conceive.
Still wants to conceive.
Have a baby of her own.
Yes.
Yes, there is options.
There are options.
There are
There you
plenty.
go. We're just placing it there because I knew this question came last time, and it's again here because we see a lot of it's becoming.
Yeah, there are.
Yeah?
There are.
So we are talking about sperm donations here.
Yes,
Just
donor
to
sperms.
clarify, yes,
Yes.
sperm donations.
Sperm donations. If the sperm, we usually ask for the kind of blood group and not in details of the complexion, the hair texture, but
Okay.
no eye color. So all these few data can be
But are
matched.
these options?
Not to be addressed, but the blood group mandatory,
Okay.
because a negative blood group of the lady with a positive sperm will not going to be good. It's not going to be a good match. So the blood group is always mandatory.
Gender? No.
No,
Doctor.
because it is nature.
Let at least some part of it be natural.
Yeah.
There you go. All right. Success rate, doctor. I know this was going to come. Let's
All
talk
right.
about the success rate.
Success rate with me, I will speak, because with me, every details are attended.
Okay.
Every small issues are addressed. Once you address small issues which are neglected, sometimes usually helps in correcting the major issue hiding behind. So with me, the success ratio is 98%.
Okay. Well, there you go, mesdames and messieurs. 98%. You can, of course, contact
The
Dr.
2%, I'm telling, they don't listen to me.
Pas quand
If
t'as
I-
écouté.
I tell them to calm down, they're over anxious.
Yes.
And I am always available for, they can give me a full book of doubts. I'll sit and clear for them,
Yeah.
because they need to be crystal clear
Yeah.
before taking this huge step. And whatever it is, they need to understand what they're going through.
Yeah.
They're not being blindly pushed into some chamber, collect, give, go.
Yes.
No. It is addressed like we are addressing with humanity.
It's a walk-through process, at
step-
every given
yeah,
point.
step by step.
Okay. And of course, if you have any questions, it is answered. What is the duration of the treatment, doctor?
The duration is 14 days,
14 days.
2 weeks.
Would you consider telling the couple to take leave during those times?
Yes.
Is it encouraged to take
Yes.
leave?
For the male partner, I require only 4 days.
4 days leave?
Yeah.
Okay.
Day 1, they walk into the chamber.
Yeah.
Day 2, allowing the complete analysis of blood
Mm-hmm.
test. Day 3, after 2 days of no sexual activity,
Yeah.
collection of sperm. Day 4, we freeze the sperm.
I would even ask for more. At least two days prior, just take a day off.
Yeah.
Take 2 days off. Put yourself in the mindset that when you do come to day 1, you are rested. Yeah?
Yes.
Yeah.
And it is the lady from second day of period
Okay.
to a max of 10 days. So I always give like plus or minus, so 14 days in our hand
Okay.
for the baby, anything for the baby.
All right. Or
For
if you wanna,
motherhood.
as a couple, take the 14 days together and the whole process is done.
It's
as a,
done.
As a team.
Yeah.
Yeah? Okay.
The partner support is more needed for the
Yes.
lady. See, he can give the sperm and he can, get back to his
Yeah.
work. But his presence there
Yeah.
changes the whole mental shift for
Yeah.
the lady. It's consoling.
Yeah.
It's comforting. As a gynae, I can talk to them. But as a family, they have the understanding beyond words. So it's a comfort the couples give each other that will result in good quality eggs.
I have one question from a lady. Good morning, doctor. Getting pregnant through sperm donor. Does the male donor have rights over the baby after birth? What are the legal the legal implications of sperm donation? See, I see the ladies are very interested in that.
Good morning to her.
Yes.
There is no legal rights over the baby because the donor ID is not revealed.
Okay.
You don't know the donor's ID.
Yeah.
It is in the bank.
Yeah.
The exact data of the name, the person, the location is not revealed.
Yeah.
It is
It's
a
just
bank.
a number.
Yeah, it's a bank. We collect, like you have a donor bank,
Yeah.
and we match the blood group.
Okay.
Priority is the blood group.
Okay.
And minute details falls next, like eye color and hair color.
Okay.
All right? Because these are very specific.
Yeah.
So, and after matching the blood group, we collect the sample with good quality sperms.
Okay.
And nobody knows whose sperm or like the donation occurred.
All
It is
right.
from the bank we collect. Like the blood, we get blood donation. We don't know whose blood. It just says B positive or positive, then we go for the transfusion. It's
All right.
similar.
Now, doctor, IVF treatment in Seychelles or overseas?
IVF treatment can be started in Seychelles in Dr. Moti's clinic
Okay.
and can be finished in Chennai in my place in Suganya IVF.
The-
See the screening,
Yes.
the process of evaluating the male partner and addressing the small issues here, I can do up to that.
Yes.
But the main collection of sperm
Yeah.
and egg will be done in Suganya IVF in Chennai.
Okay.
And the freezing happens there. I want to add one more point.
Yes, please.
The sperms that can be frozen can be kept for 10 years.
Okay.
So she can come back and have another baby.
So you don't need to repeat the whole process again?
Yes, that is the key
How
here.
healthy
It will
is
be.
that?
It's very
the
good.
frozen eggs and the
Yes.
frozen sperm.
They are very healthy.
Okay.
Because they are maintained at good temperature.
Yeah.
Like it is in the ovaries. We give the same temperature like it is in in the human system.
Okay.
That is the latest advance I'm talking about here.
So you keep that for 10 years for
Labeled if they want.
If they want.
If they want.
This
The key
is
here.
upon request.
Upon request, yeah.
And it has to be specified very early.
Yeah,
in
very
the
early because we need a separate chamber.
Yeah.
And there is no mix and match there.
Okay.
So it is compartmentalized and we put it in.
All right. Okay. So, ladies and gentlemen, doctor, I mean, we are bordering the end of our conversation, but is there's anything else you would like to share with us concerning IVF treatments for couples who might want to
All right.
explore the possibilities of this
All right.
magic, we call it,
Yes.
this
I
morning?
have few questions from the couples usually I encounter.
Yeah.
Is IVF painful?
Okay.
I always tell.
I
it
just
is
asked you on a scale of
no.
1 to 10.
A scale of 1 to 10. It is not painful as
Yes.
any cut open surgeries.
Okay.
It is an absolutely painless and free procedure, pain-free procedure. we are not going to cut, we are not going to put, unless and until the lady stresses herself mentally.
Okay.
There is no physical pain at all.
Okay.
And attending the mental stress, we comfort them, make them comfortable, and then start the procedure.
Okay.
So this is the commonest issue, is IVF very painful. And number 2, can I have twins? Can I have triplets?
Yes.
I need to
Some
highlight.
people might think that, you know, if this is an opportunity, make the most of it, have 2 or 3, get it out of the way.
I can understand, but I recommend only 2. Twins, yes.
Yes.
Triplets, not good for the mother.
Okay.
Chances of miscarriages are very high.
Okay.
And imagine 3 babies in the womb, the amount of exertion needed is deposited on the lady, like physically, energy-wise, and whatnot. So many complications of multifetal gestation.
Okay.
Yes, twins are common in IVF, I agree.
Okay.
But not the triplets. If in case of triplets, we see how the expanding capacity of the womb is, the space available for 3 babies to grow. And if nature allows, we allow, right? That is one.
Yeah.
And another question which I frequently, asked by the couples, how long can I wait? How long can I take the decision next year?
Okay.
Or already when they are in their late 30s and early 40s, how long? There is no time limit, please. We are not sitting here on a cushion where we have enough time, okay, next year
We're
or
on
the
a
year
ticking
after.
clock.
Yes, the clock is ticking. The body has got a clock inside ticking every minute.
Yeah.
So better you come early.
Okay.
And reach out early, and then I'll be able to address the issue at the faster rate. Because getting late, still we will be able to give them. But the problem is the number of embryos getting collected will be the challenge here.
We want
from quality and quantity.
Quality and quantity.
We are targeting
and with time,
both.
Quantity is reduced.
Yes, quantity is reduced, then we are left with no option of collecting 1 egg, and we are now keeping our fingers crossed that this should happen.
Yeah.
Let's not stress ourselves when we are given enough time. Please focus on your body, focus on your priorities. If babies are priority, plan your schedule accordingly and reach out.
Or option to freeze your eggs.
Yeah.
This is also an option.
The 4th one which I'm asked is like fibroids.
Yeah.
All right. And fibroid post myomectomy, after removing the fibroid out, is there a possibility of IVF? Yes.
Okay.
There is enough possibility that the womb receives the baby.
Okay.
No problem with that, only that she requires extra care.
Okay. All right.
Regular antenatal visits and regular checkup.
And a positive mindset.
Yes. The key is the positivity. Positive mindset, stress-free.
Doctor, I think we've had a lot of information. We've given out a lot of information. I think we've set the pace for that conversation with you and your future patients and your clients, as we say. And let the magic begin.
Yes. Never lose hope. Every baby is a miracle. And miracle always happen. And with me, fingers crossed, and with all the positive energy I can give to all the couples who are wishing to become pregnant, and I give them maximum effort and chance and choice, and let the quality not be compromised. Please focus on the quality. Stay away from alcohol. Say no to smoking. Please reduce your screen time. This is the message I'm keeping on table today in Bonjour César.
And ladies and gentlemen, this is where the magic happens. We've had this conversation. IVF est traitement qui a exploré. Of course, we're capable de contact avec Dr. Suganya. Doctor, quickly your number to facilitate conversation.
Yeah, my number, please reach out to 750-999. And I will be visiting Cecil's again. I'm here until Friday. I'm here.
Yeah.
Mope vini Cecil.
Encore.
June 23 to 23.
23 to 28.
Yeah, June.
So
again,
you will be back
coming.
in June.
Yeah.
All right. So
please prepare yourself.
Yes.
You're given time. Talk about it. Please talk about it. I need the couples to have a conversation first. Please talk about it. Talk about the baby. Talk about how early they can preserve the quality.
Okay.
and reach out
Yes.
for us, like so we can guide and help them.
All right. Ladies and gentlemen, mesdames et messieurs, aujourd'hui bon matin, IVF, il y a un traitement qu'on est capable d'explorer. Si il y a un qui est intéressé, comme un couple, par dit, ça positive mindset, ou bien faire si, qui ont paré, question il y en a, la réponse il y en a, traitement il y en a, mais at the end of the day, il est important pour ou commencer la conversation avec vos partenaires, décider qui direction vous avez envie d'aller, et of course, Dr. Suganya,
Yeah.
il s'en qui est capable de répondre à cette question.
Yes, God has given the lady a beautiful womb to carry the baby. And there is every possibility for the lady to conceive. And when there is difficulty, we as medical professionals are available at help. We are just extending our service,
Yeah.
so making their dreams come true. So extension of have hope and prayers are therefore out for all couples who are trying to become pregnant. Never lose your hope. Stay very positive. This is Dr. Suganya Saravanakumar signing off from Konversasyon and see you soon in June 23.
Well, there you go, mesdames et messieurs. Aujourd'hui, bon matin, Dr. Suganya, il donne nous l'espoir pour ou qui est dans la cour, qui imagine on a des enfants de l'effiti. C'est notre topic conversation. Pour aujourd'hui, bon matin.